Have you ever wondered how many ultrasounds are actually safe during pregnancy? Ultrasounds have become an essential part of prenatal care, providing a glimpse into the womb and reassurance that everything is developing as expected. In fact, most women have at least 2 or 3 ultrasounds during their pregnancy, with some having as many as 6 or 7. But what's the real purpose of these scans, and how often should they be done? The importance of ultrasounds lies in their ability to detect potential issues early on, such as fetal growth restriction or birth defects. They also provide crucial information about the baby's position, movement, and overall health. Moreover, ultrasounds have become an emotional experience for many expectant parents, allowing them to bond with their baby and even determine the gender. Despite their usefulness, ultrasounds have sparked concerns and debates among medical professionals and expectant parents alike. Some argue that too many ultrasounds can be harmful, while others believe they're essential for ensuring a healthy pregnancy. But what are the potential risks involved, and how do we balance the benefits of ultrasounds with the potential drawbacks? One of the primary concerns surrounding ultrasounds is that they may be overused, particularly in low-risk pregnancies. This can lead to unnecessary interventions and increased anxiety for expectant mothers. Additionally, some research suggests that excessive ultrasound scanning may have long-term effects on fetal brain development, although more studies are needed to confirm this. Another issue is that some medical professionals may be using ultrasounds as a way to avoid liability, rather than as a necessary diagnostic tool. This can result in unnecessary scans, increased costs, and a lack of personalized care for expectant mothers. Furthermore, the rising popularity of 3D and 4D ultrasounds has raised concerns about their safety and effectiveness, particularly in terms of fetal exposure to high-frequency sound waves. The debate surrounding ultrasounds has also led to questions about who should be performing them. Should it be obstetricians, radiologists, or specialized ultrasound technicians? And what kind of training and certification should they have? The answers to these questions can significantly impact the quality and safety of ultrasounds. Moreover, the frequency and type of ultrasounds can vary significantly depending on the country, region, and even hospital. This lack of standardization has led to confusion among expectant parents who may not know what to expect or what's considered normal. It's essential to establish clear guidelines and protocols for ultrasounds to ensure that they're used effectively and safely. There are several types of ultrasounds, each with its own purpose and benefits. Standard 2D ultrasounds provide a basic image of the fetus, while 3D and 4D ultrasounds offer more detailed and lifelike images. Doppler ultrasounds, on the other hand, measure blood flow and detect potential issues with the placenta or umbilical cord. Health professionals recommend that expectant mothers undergo a series of ultrasounds throughout their pregnancy, typically at 7 to 10 weeks, 16 to 20 weeks, and 28 to 32 weeks. The American College of Obstetricians and Gynecologists recommends that ultrasounds be used only when medically necessary, and that they be performed by trained professionals. However, what constitutes medically necessary can vary greatly depending on individual circumstances. It's essential for expectant parents to discuss their ultrasound schedule with their healthcare provider and understand the reasons behind each scan. When it comes to the number of ultrasounds during pregnancy, expert opinions vary widely. Some recommend a maximum of 3 to 4 ultrasounds, while others believe that more frequent scans are necessary for high-risk pregnancies. The key is to strike a balance between necessary monitoring and potential risks. Health professionals must consider individual circumstances, medical history, and the risks versus benefits of each ultrasound. Excessive ultrasound scanning has been linked to several potential risks, including increased anxiety, unnecessary interventions, and even physical harm to the fetus. However, in cases where ultrasounds are medically necessary, the benefits far outweigh the risks. Expectant parents must be informed and involved in the decision-making process, and health professionals must prioritize their safety and well-being. In conclusion, the question of how many ultrasounds are too many during pregnancy is complex and multifaceted. While ultrasounds are an essential tool in prenatal care, Their frequency and type must be carefully considered to ensure the safety and well-being of expectant mothers and their babies. It's essential to establish clear guidelines, prioritize individualized care, and encourage open communication between health professionals and expectant parents. So, have you had any experiences or concerns about ultrasounds during pregnancy? Share your questions or stories in the comments below, and be sure to check out our other videos on pregnancy health and wellness.